Vertusio, the shout-out app for industries, businesses, and services.
Disruptive innovation can help solve healthcare's accessibility problem. The U.S. healthcare system is costly and filled with logistical and institutional impediments, which add to a lack of accessibility. According to a 2020 survey, about 25% of Americans avoided medical care due to the cost. Since 2017, the uninsured rate has continuously increased, with 10.9% of non-elderly Americans lacking health insurance in 2019. Furthermore, millions of individuals live in healthcare deserts, with 16% of citizens living at least 30 miles from the nearest hospital and nearly 30 million living more than an hour away from the nearest trauma center. Given this, payers, providers, and regulators should prioritize making healthcare more accessible. However, all too frequently in healthcare, the emphasis is on innovations that add to the system's costs. While these technologies help improve healthcare, they continue to raise the cost of highly specialized care while doing nothing to broaden access to care more broadly. These are what we refer to as sustaining innovations. Sustaining innovations do not create new markets. Instead, they often raise the price point of existing items, making them less accessible to low-income consumers. Robot-assisted surgery is an example of this in healthcare. A Da Vinci robot, one of the most well-known names in robotic surgery, can elevate the cost of laparoscopic surgery by $3,000 to $6,000, even though robotic surgery is being lauded as the future of surgery. What are disruptive innovations? Disruptive innovations are opposed to sustaining innovations. Their goal is not to improve the existing quo, but to change it by opening up the market to those who have traditionally had difficulty accessing it. Disruptive innovation refers to the process through which a product or service first establishes itself in simple applications at the bottom of a market, usually by being less expensive and more accessible, and then persistently goes upmarket, eventually replacing established competitors. 3 things are required for successful disruptive innovation. Technology that enables. An enabling technology is more than just a new shiny thing. It is, instead, a technology that makes a product or service more affordable or accessible to a specific group. Telemedicine is a fantastic example of this in healthcare. Video chat or texting with a doctor provides medical treatment to millions of people who live in care deserts, a unique business concept. A disruptive invention is distinguished because it does not target high-end consumers. Instead, it focuses on non-consumers, new customers who previously did not purchase items or services in a specific market, or low-income consumers, the least profitable customers. A disruptive innovation must be matched with a business strategy that effectively targets these clients to work, a network of coherent values. In an unfavorable business environment, innovators cannot expect a disruptive idea to take hold. A cohesive value network is one in which suppliers, partners, distributors, and customers all benefit from the success of disruptive technology. Taken together, these characteristics of disruptive innovation provide access to items and services that are often out of reach for the majority of consumers. Those who stand in the way of disruptive innovation compared with those who could support it. It does not stop there, however. The 6 forces that can either halt or accelerate innovation are as follows, taking into account stakeholders: accountability, funding, policy, players, technology, consumers. As a result of the lack of significant disruptive innovation in healthcare, these forces are likely working together to keep threats to the status quo from taking root. What is the significance of disruptive innovation in healthcare? The lack of access to health care has far-reaching ramifications for those affected. A lack of primary care, in particular, harms health outcomes and increases healthcare expenses since hospitals are called upon to deal with medical concerns that arise as a result of a lack of preventative or primary care services. On the other hand, health outcomes are worse when there is a shortage of healthcare available. It leads to an unhealthy population, which is awful enough in and of itself, but it is doubly tragic since there is so much that can be done to avoid negative health implications from occurring. On the other hand, disruptive technologies are already having an impact on increasing access to healthcare. Throughout the COVID-19 outbreak, telemedicine played a significant role in ensuring that people had access to life-saving medical care. The significance of disruptive technology in a sector as critical as healthcare, but one that is difficult to reach, is easy to comprehend. Making healthcare more affordable and accessible opens the door to millions of people, resulting in a healthier population and reducing overall healthcare expenditures.
If you've enjoyed watching this video, then give this video a like and share with a friend. Also click on the subscribe button below to be notified as new videos are released.